Welcome to our sepsis use case. So our scenario here is Natasha is a 40-year-old woman who has been admitted to the emergency department with abdominal pain. So to start off, the clinical staff go through some general diagnostics, take some vitals, order a lab, as well as order a CT of the abdomen. So at this point, we'll pass over to Phillips to talk about the CT.
Okay, so Philips View PACS receives the order from Epic for Natasha's CT, and the exam is performed, and the study with the images is made available on the workbook to be reported. As the radiologist opens the images, he realizes that there is an abdominal perforation. He's interested in knowing if any priors are available. The radiologist can see there are some priors available, such as prior X-ray images. This X-ray is from a few months ago, performed in one medical center in another region. This was made available by Philips Health Suite Interoperability. View acts as an XDS consumer of the data in the Suite Interoperability XDS registry that was in turn retrieved from other XDS repositories. These previous studies and reports are received to View via orders trigger. These studies can show across several institutions using EMPI. The context information helps on the report as the X-ray indicates a peptic ulcer, a potential cause of the perforation. Also, it is clinically known that a perforated ulcer can result in peritonitis. So this is key info to Natasha's record. The radiologist dictates the report while pulling priors and medications from different institutions. View multimedia reporting enables this to be made easily. Hyperlinks with all the priors available will be inserted in the report. The patient can access the report and images, including the priors, while reviewing and assessing Natasha's medical condition. Back to you.
All right, so given all the clinical data that's been collected so far, the nurse begins to suspect an infection. So we will launch over to the Luminare Sagita app to screen for sepsis.
Yeah, so as you can see here, the data has been pushed from Epic to our platform, and we can see that our patient, Natasha, has screened positive for SIRS with the abnormal temperature and white blood cell count. So we're just going to continue the screen here, and we're going to click this bar. That will take us to our sepsis screen. Since we're suspecting that she has infection, we're going to select this here, continue the screen, and no data from Epic proved that we had severe sepsis onset, so we're just going to surpass this level. And this is going to compile the abnormal temperature, the white blood cell count, and the suspected infection, and we're going to click submit and order the bundle here. We'll click save. And that's where the sepsis screen is done. We're going to push, send the data back to Epic, and then the bundle will be ordered, and Baxter will take over from here.
Yeah, so we just completed that sepsis screening, which indicated that Natasha does indeed have sepsis. So that pushed some flow sheet information over to Epic, which triggered a best practice advisory alerting clinical staff in the Epic chart that Natasha is septic. So at this point, she needs help. So she's going to be admitted to the ICU, and we will begin to administer medication.
Right, so our patient's been admitted to the ICU. She's been prescribed Permaxin, 5 milligrams per milliliter, to be administered for over 30 minutes. So at this point, the order is sent to the pharmacy to be filled, and then the syringe with that medication is sent to the floor. So once the nurse has a pump available for administration and then has the syringe, they would go ahead and scan the patient's wristband in order to open their medication administration record, or MAR, in Epic. They then scan the syringe in order to open the order in Epic. And then they would scan the barcode on our pump here in order to associate the device with the order and the patient. So once that's complete in Epic, Epic will send the order wirelessly to the pump. And at this point, we've received the order, so we'll accept it. So then we'll specify the syringe we're using, so it's a BD 50 ml syringe. So yes, here. We won't prime for this demo, but you can. At this point, now validate all the parameters that are the same as Epic. So we do that. So we will accept the program here and then start the infusion. And as you see on the screen, Epic received the pump run. Epic also would receive a pump stop and the order complete back from the pump as part of auto documentation, as well as any periodic updates from the pump as well, or any changes that the nurse makes to the pump.
So this demonstration here is actually based on a real-life patient case. This entire workflow that you've seen here took a maximum of 15 minutes. The average length of time in detecting sepsis in patients is 7 to 48 hours. And for every hour you wait, there's an increase in mortality from 7 to 10%. Through this interoperability showcase, we're able to provide a process of detecting and treating a patient with sepsis in a quick and efficient manner. Thank you for your time.